Good morning, everybody. This is the Anchorage Emergency Operations Center update for April 29th. A quick reminder to everybody that this is being recorded. All right, here we go. We got our sleeves up for summer. Here's one of our flyers that are going around. And again, just that reminder, anybody 6 or older working or living in Alaska can get vaccinated. And there are plenty of appointments available. And big push next week for vaccine week, the 1st through the 9th. It's kind of starting on Friday. There are ample opportunities to get a vaccine in the next 7 days. So please help those take advantage of it. And we'll move on. Situation report.
Good morning. This is Luke Orrit here, Situation Unit Leader in the EOC. Today is day 421 of our response. As currently reported, globally, we're up 2,531,629 cases since the last report on Monday, and up 43,016 deaths. Nationwide, up 162,182 cases and 2,246 deaths. Statewide, up 753 cases, 12 deaths, and 26 hospitalizations. And locally, up 165 cases, 2 deaths, and 7 hospitalizations. Next slide, please. For 213 resource requests, we've filled or otherwise satisfied 1,738, an additional 5 since the last report, with 23 currently open and working. Next slide. There were 30 non-critical transports in the last 24 hours, 6 of which were after hours. In the congregate sheltering sites, we have 397 clients, down 14. In the non-congregate sites, 311 clients, up 42. A total of 708 clients in all shelters, up 9, averaging 2,124 meals served per day. Next slide. Yesterday at the Visit Healthcare testing sites, there were 749 sample collections performed. And yesterday's daily vaccine counts at Active Pods: Dempsey Anderson, 12 doses, Blood Bank of Alaska, 36 doses, Shiloh Baptist Church, 53 doses, and Diamond Center, 42 doses. End report.
My name is Cynthia with the National Weather Service in Anchorage, and unfortunately, summer is over. Just kidding. So today we have chances for rain throughout the day, about 50% chance. And then tonight, temperatures are actually supposed to drop below freezing, so there's a potential for a few snowflakes to be mixed in with that. And then Saturday, we will return to the sunshine, but we're going to stay on the cooler side in the low 50s. End report.
Good morning. This is Pat Ryder, Deputy Operations Section Chief. This morning with Mass Care, our Q&I location has 4 projected discharges through Sunday. That's to include 3 discharges today. And our warming tent had 45 people over the past 24 hours. With public health, Visit Healthcare testing had an increase of 2.38% over previous Wednesday's sample. Our 7-day rolling positivity rate average is 2.21%. Our 14-day average reproductive rate, 0.879. Our 14-day average case rate is 15.72 for every 100,000 people in the population. With pop-up testing on May 1st, we have Muldoon Elementary School from 8 in the morning to 7 p.m. this evening. Next slide, please. With medical countermeasures, just to remind everyone, our mobile vaccine clinics can bring the vaccine directly to wherever you are, be it a business, workplace, church, or other organization. For more information on that, please feel free to visit our municipal website under the vaccine tab. Alternatively, you can dial 907-531-5100. We also offer vaccinations for the homebound people. So for more information, again, that number is 907-531-5100. Walk-ins are welcome at all 5 Visit Healthcare clinics. That's to include the drive-thrus and the Alaska Airlines Center. Speaking of which, the Alaska Airlines Center schedule is Mondays, Wednesdays, and Fridays from 8 a.m. to 12 p.m. And all 3 vaccine types are now available for walk-ups. And we're proud to announce that Vaccine Week will be beginning this weekend. That will include late-night drive-up clinics Friday and Saturday night at the Midtown Mall from 6 p.m. to midnight. Our Saturday kickoff event will include a car show and a Polynesian dance competition at the Northway Mall drive-thru. That's from 1 p.m. to 8 p.m. And the Girdwood Community Center pop-up clinic is Saturday morning from 7:30 a.m. to 2 p.m. And our Kentucky Derby pop-up will be at the 907 Ale House Saturday afternoon. That's from 11 in the morning to 2 p.m. Barring any questions, end of report.
Thanks, Ops. Logistics.
Hello, it's Scott Carpenter, the Logistics Section Chief. Here's a look at our lines of effort for mass care. We're working the summer shelter requirements and the support services as usual, and beginning preparations for the closure of the Fairview Rec Center and the warming tent locations. For medical countermeasures, we continue to support the vaccine week with various services, as well as the other vaccination sites. For the rest of the EOC and AHD support, we continue to work staffing, transition planning, and support for the Northway Association events. Pending any questions, that's logistics.
Good morning. This is Carrie Wiedeker reporting for the EOC Finance Section Chief. The current encumbrances are $18,813,525. Our actual spent to date is $49,392,648. Our total is $68,206,173. Please continue submitting invoices for costs related to the COVID event to eocinvoices@anchorageak.gov. The Office of Emergency Management does continue to seek cost recovery by way of FEMA public assistance. If you have questions about that, please contact Erin Zachary. End of report.
Thanks, Gary. Safety.
Good morning. This is Annalisa Roberts reporting out for safety. With spring and summer coming, we have a lot of special events coming up, holidays, birthdays, Mother's Day, Father's Day. So if you are going to celebrate spring events and holidays, just try to do so safely. Hosting a video chat party is good. You can also plan a special meal inspired by the holiday or event. For instance, having Mother's Day brunch in bed for your mom. Having an outdoor celebration with friends and family with appropriate spacing and cleaning protocols. So people who are fully vaccinated can now get away without wearing a mask and being in outdoor settings safely. So just keep that in mind whenever you're visiting with people. Still try to limit the number of people there, and if possible, avoid indoor activities that don't allow for proper distancing or ventilation, and avoid foods that require shared utensils. So just get out there, enjoy our spring and our summer, be safe about it, and wish your mothers happy Mother's Day. And report.
Hey, good morning, everybody. This is Kel Casey for the EOCPIO crew, where we have location-specific messaging by Northwest Strategies to target the populations in Gerwood and Eagle River to make sure they know about their vaccine opportunities for Vaccine Week. It's a high priority to see if we can get uptake in that area. Flyers, social media graphics, and others are developed, and they're out, and they're being shared with our partners for the pop-up clinics. So there's been one per clinic already made and out there to try to drive to each specific effort that MCM has been doing for us. Sharing social media graphics with clinics of the day, so featuring a particular interesting one per day to post during Vaccine Week to keep it interesting and get some media buy-in. Coordinating with Shannon Kuhn at the state, who offered to help us with photography and video for Vaccine Week to amplify that message. Banners for the mobile vaccination units are completed. They look really nice. We've prepared messaging for the 12 and above tier, so we're ready to go in case that happens next week or anytime. Our outreach email continues to build that list and deepen our outreach. And this morning, one of our PIOs facilitated a film crew at the Sullivan to ensure that they understand how to operate in these settings.
Good morning. This is Celeste Prescott, Liaison Officer for the Anchorage Emergency Operations Center. I'd like to thank all of our partners who are able to join us today. Do we have any cooperators out there that would like to report out? Okay, hearing none, we'll jump right into the hospital reports. And from Alaska Native Medical Center, Kirsten is reporting 3 positive cases, 1 in the ICU, no one on ventilators or people under investigation. And I believe Sean is on with Alaska Regional.
Good morning. Alaska Regional Hospital currently has 7 COVID patients, 1 in the ICU, no vents, 1 PUI, and lots of patients on high flow oxygen.
All right. Thank you very much, Sean. And is Michael on for Providence Alaska Medical Center? All right. Looks like Michael was not able to join us today. And do we have anyone on for the 673rd Medical Group?
Good morning. This is Sergeant Perez with the 673rd Medical Group. Reporting out our vaccine numbers. As of yesterday, we have administered a total of 15,660 vaccines, 8,568 of those being the first dose, and 7,092 being both doses. Pending any questions and a report.
Thank you very much. And Matsu Regional Hospital is reporting 13 positives, 6 of which are in the ICU, 5 on ventilators, and no PUIs at this time. Thank you, and that's all for Liaison.
First, I want to thank Weather for mitigating our wildland fire risk. I'm only half joking about that. We always worry about simultaneous disasters. We know from other parts of the state that happened last night, and we're in fact running a wildfire evacuation exercise simultaneously with today going on. So we have to be prepared for those, and a little mitigation of that concurrent risk is great. Incidentally, we started this training on Tuesday when a 4.9 aftershock, now reduced to 4.8, reminded us that we don't control the time flow of these things. So we're making great progress on, I think, on many fronts with COVID, but we can't lose track that we always have to be in a state of readiness, whatever curves may be thrown our way. End of report. Thank you.
All right, folks, our next meeting will be May 3rd. That's right, in May at 10 a.m. Monday morning. Thanks, everybody.